Okay. After that inspirational session, I think we've all realized how important it is for us to be healthy, to really scale our own Everest. So moving on, we now have the healthcare panel. Healthcare in India has traditionally posed a lot of questions around its accessibility and affordability for most of the population. Adoption of disruptive technologies in healthcare will help India reimagine the future and make quality healthcare more affordable and uniformly accessible across the country. So this panel that we have today, they will deliberate on the next big opportunities in the healthcare market, answer pertinent questions to demystify the growth of digital technology-enabled healthcare. May I invite on stage my colleague, Dr. Nirod Kumar, who's the Director of Transformational Health in the Middle East and Manasa region for Frost & Sullivan. Welcome, Doctor.
Thank you, Neeta. Can I have the attention of everyone present here? I understand healthcare is not probably, we donate it very naturally to the healthcare professionals, the doctors, but in a democratic framework, I think it's good that healthcare is everybody's stake. Because when that function goes wrong, quite a few serious things can impact our society. Interestingly, we're at a stage in the evolution of healthcare in our country where we are a tremendous possibility. We have put together a very distinguished panel to discuss the opportunity, challenges in terms of adoption of digital innovation. We understand that as healthcare providers, we take the advice of the professionals, but the other side is that healthcare professionals and the health system needs also caring. The panacea could lie in digital innovation and tools that we consider as disruptive innovation. Allow me to welcome on stage my panelists. Rajesh Batra is the VP of IT, Kokilaben Dhirubhai Ambani Hospital. Rajesh Batra is currently the VP of the Dhirubhai Ambani Hospital. It's a CSI initiative of the Reliance Group. He has been involved with different strategizing IT implementation of HIS and SAP. Next is Santosh Marathe, COO of Apollo Hospital Western Region. Santosh Marathe has work experience of around 2.5 decades and 18 years of that in healthcare. His career has transcended across manufacturing, consumer goods, and healthcare. Give a good round of applause, please. Next, I welcome Dr. Shenoy Robinson, Managing Director of Catex Healthcare. Dr. Shenoy is a dynamic thought leader in healthcare industry with proven expertise in providing corporate vision, strategic planning, business development, and execution of innovative solutions for large hospital chains. Next is Ajay Mahipal, the Head of Investment, Cure Health Tech Fund. Ajay is a qualified chartered accountant and MBA from IIM Lucknow. He is an accomplished professional with over 14 years of experience across investment management. Dr. Rohit Madhav Sane, founder and managing director of Madhavbagh Clinics and Hospital. Dr. Rohit Sane is the founder and managing director of Madhavbagh Clinics and Hospitals in India. Dr. Rohit uses education in modern medicine and undertook a meticulous research into Ayurveda. So we have this eminent panelists for you, ladies and gentlemen. The theme, we have structured this in order that healthcare becomes interpretable and you have some takeaway at the end of the day. The idea of digital innovation adoption within the Indian context has been a continuous debate for the last 2 decades. I would structure this question probably in certain theme and let me moderate this from here. And my first question would be to Rajesh. Digital health is becoming a business imperative, Rajesh. So from your perspective on the ground and that you run a large hospital center yourself, can you help us define what are the key criteria in terms of what are those which are impacting this business imperative?
Health as it stands is itself a disruptive thing because nobody wants to go to a hospital yet they end up landing in one.
Sure.
And we don't want to fall sick, but we end up falling sick for whatever we do. And the biggest challenge today is data. How do we get the patient data into the hospital and back to them, which is useful to them and to the hospital in the long term? And that itself is leading to the digital disruption we have. And the challenges which we are facing in India is one is scale of digital, because internet is still not all pervasive and all available. And even if I go outside of Mumbai, it doesn't work really well. And on top of it, we don't have thin broadband, we have broadband, and we're wasting the bandwidth. IoT doesn't need broadband, but needs thin broadband, and we're wasting it, big time we're wasting it. And the other thing, big thing, is change of socio-political and economic factors. Who can afford it, who can't afford it, is what we are facing as a challenge. And then there is inherent tension. What if my records are on the cloud? Who will use it? Who will not use it? And how do I access it if I forget what is there, what is not there? And how can it be detrimental to me? That is the biggest challenge I'm facing. And the bigger challenge comes for marketing and branding people. How do they brand a hospital which is digital? Because patients want to still see a doctor at the end of the day and get that feel and touch thing and get comfort when they go home that the doctor examined me and he's prescribed some medicines which will work for me. And the bigger thing, which as a technical people, are interoperability and data confidentiality. India still doesn't have HIPAA. So that data confidentiality is still a question mark hanging over our heads. And as I said earlier, usage of data for improving safety and quality of treatment to the patient is the challenge we are facing. And this is what we are dealing with. And as I said earlier, scale, because every hospital is a pocket. What if there was a bigger deal to make this accessible to millions and millions of people? We don't have that, and as a result, this cost is still not coming down.
Sure. So are there any learning points, if you may, from countries' advanced health system, if you may, comparable, probably where the PKI norms are more mature, like in Australia or whichever way, which can help accelerate some of this adoption?
So let me take an example. Right out of my hospital, we started this portal about 4 years now, and I count the number of unique hits on the site. Average has never gone beyond 750, and they say Mumbai has the largest users of internet.
Sure.
If that is a piece of data, because in the area of healthcare, people want to come to the hospital, meet the doctor. That is the bigger challenge. And if you look into a group of countries in Scandinavia, 6 months they do not have sunlight, 6 months the roads are not accessible. Yet they deliver healthcare to the rural areas. And that is where IoT is working. And believe me, I haven't met a single Scandinavian who said, I don't have access to healthcare during winters. They have access and more access every time. And IoT is working and delivering. We look at China, Korea, America, where IoT is still in a very nascent stage. And here a small group of countries with population less than 30 million? And they have IoT working and communication networks working in freezing winter. And where people have no access to road or going out, and yet they get their doctors coming to their doorstep, delivering healthcare at them. And they are monitored 24/7 in case of a sickness from their home, in the comfort of their beds and drawing rooms or whatever you want to call it, and get quality healthcare. That is an example we should look for rural healthcare, not the ones we are importing from Canada or anywhere else, where accessibility is still a challenge.
Sure. So that brings to the perspective that there are challenges which are within the system, and there are challenges which are actionable from a adoption standpoint. I would want to ask Ajay Mahipal in terms of how because we have the next session on the startup by Arup, but since is a very interesting venture that he actually has a portfolio of a lot of unique startup, how do you define innovation in the context of how you invest in these digital health initiatives?
Yeah, no, thanks for the question. Let me just set a bit of a context in terms of where is India in terms of global healthcare, and we'll come to the role of digital health in India, because we don't see any other way India can get access to quality healthcare if technology were not to be used judiciously. So just in terms of some macro data, India spends about less than 4% of its GDP on healthcare. US is about 15%. Most developed nations are above 10%. You look at per capita healthcare spend, India is about $60. China will be 10 times that, and US is a far cry at $3,000 per person. You look at the deficit of healthcare in India, we are about 1 million doctors short, we are about 2 million beds short, and we are about 3 million nurses short. So, given this backdrop, there is no way that such a huge infrastructure can be created over next 5-10 years where the demand can be adequately met through our traditional means. So we have to resort to digital health. What are we seeing there? Though it's still a young start from from an India portfolio perspective for us, we are already seeing about 1,000 health tech startups trying to tackle this problem. And I'm sure there'll be more and more as time goes along. What have we seen there? We've seen some really interesting models. We've seen across telemedicine and e-pharmacy, which are bringing quality access of healthcare to a larger audience in India. Currently, obviously, the numbers are not staggering for anybody to get super excited, but I'm sure we'll catch up soon. We've already seen in mental health and sexual health, telemedicine has come as a boon to a lot of patients, stroke customers. The topics that they're not comfortable discussing or not comfortable stepping out of their homes to have in-person consultations, but happy to do it over phone. We are seeing that in chronic illnesses like diabetes, where adherence becomes a major issue. We are seeing companies being classified as digital pill, partnering with pharma companies, rolling out their solutions, and making sure adherence is high, and therefore the patient outcomes are better. We are seeing that even in data analytics, one of the earlier panelists spoke about data. Data is key, data is the new oil, and we are seeing companies, how they are collaborating with pharma companies, insurance companies, and healthcare providers to bring down the cost of healthcare delivery and also at the same time improve overall patient outcomes. So we are super excited about the role of digital health in India, and a lot of startups are essentially going to tackle the infrastructure problem in more ways than one.
Sure. So what would be, the key kind of advice that you would have in terms of all the practical things on the ground for digital health startup?
Right. It's very interesting. We've seen over 400 companies in health tech, and you wouldn't believe that almost 75 to 80% of health tech startups are started by people who have technically no clinical or healthcare background. So that is where a lot of help is required to be given to the entrepreneur to essentially help him understand this new industry. So he may have started his venture because of a personal incident or some inspiration that he got, but the ground realities at times are very different. So we run a chain of hospitals also within the group, and we are able to combine our healthcare services experience with the technology mindset to sort of guide them or mentor them to sort of build their businesses better.
Sure. So my next question is to Dr. Rohit. He has a very unique combination in terms of the program that he runs in his venture, in terms of how he looks at innovation in the context of healthcare.
Okay. Like for example, many a times innovation in the context of healthcare, when we think about adopting those digital tools, we think of adopting those IoT products only. And we think innovation would be all about it. I think innovation should be in the thought process. Hospitals or else the clinicians need to think about it that we need to have some business models related to it. Like for example, n number of new digital tools are there to diagnose or evaluate the conditions of patients. Like for example, a digital otoscope, a digital fundoscope. There could be digital tools by which a patient can measure his own gait in his own residence. So there are n number of tools by which evaluation and diagnosis can be done. Some business model can be woven around it to have good innovation as such. There can be still more things like, for example, for chronic disease patients, like these IoT products, they will help us a lot for chronic care of these patients. Many a times the doctors are clueless about what is happening with the patient at his residence. We have given him some medicines, we have given him some therapies, and he goes back home. Whether he follows all those advices or not is always a question that we have. When he comes back, whether he tells us the truth, whether he doesn't tell us the truth, there is always a question. So if at all we could just have some chronic care monitoring for these patients, a business model woven around it would be an innovation. There are few digital pharmaceutics that are coming, like, for example, there are few ingestible sensors that would be coming up in pharmaceuticals by which we'll be able to monitor the patient's complete compliance towards these medicines. So total innovation is going to be in the thought process of the business models that are going to come up. So according to me, only adopting these typical tools and using it in our hospitals and the clinics is not going to be the thing. We'll have to change our mindset. We'll have to change the whole perspective about looking towards it.
Sure. We, in the morning session, we talked about the increased number of mobile internet users in a country like ours. There's a possibility where consumers become proactive, and we also, from Frost & Sullivan's own research standpoint, predict that there would be a huge shift in the terms of spend that you see from the current curative bucket to a more proactive. You have this reactive healthcare that we are in that would move more into preventative. How do you see the possibility that there could be some kind of Uberization of healthcare model that would come as a possibility in our health system in country?
Absolutely, no doubt about it. Like, for example, as a doctor or as a clinician, normally we find it good as a massage to our ego that patients are there in the queue and they are waiting for a doctor for a lot amount of hours as such, and we feel good, okay, the patients are waiting, we are happy, that means we are doing something good, but the things are going to change. Like, for example, Uberization is something in which the providers will have to go to the consumers. The same way the things are going to change in the future. Obviously, it is not going to happen overnight as such, but gradually the things are going to change. Uberization is going to happen in healthcare, no doubt about it. How is it going to happen and how are we going to tackle it? That's a different question. But yes, that is going to happen, no doubt about it.
I think on that note, a round of applause for the positive outlook towards how we see healthcare.
I want to add to that. We've been trying to do that. And believe me, the doctors do not want to display their inventories so that they don't want to show the world that, you know, how busy or not so busy they want to be. That's the other flip side of the challenge I'm facing when I'm trying that.
Sure. So, Dr. Sharma, I'll come to the ROI equation last. Before I go there, I want to ask to Santosh, being a large part of the hospital healthcare system, where do you see, Santosh, we as a nation is heading towards this digital health journey from on the ground situation and also from, say, a road mapping, a possibility standpoint?
Thank you. Thank you for the invite and wonderful discussion. I think before we get into that discussion, what we need to understand is the landscape under which we operate in the Indian context. I think there has been too much overindulgence in terms of standardization of cost. Nobody is talking about standardization of care. I think that is where the main culprit in the overall problem statement lies. When we talk about concepts like digitalization, it does not come in free. It comes at a cost, and huge cost, in terms of HIPAA compliances, in terms of patient privacy, JCI compliances. So unfortunately, in the current regime for healthcare providers, there is no incentive to invest in quality. There is no incentive for me to take a step forward and invest in IT systems, which are very robust, which can get into enhanced patient care activities. So on that backdrop, definitely that's a little challenging element. But definitely it depends upon one-on-one individual institute's vision in terms of their quality mantra, what they are looking into. Another big challenge in the Indian context is what the Western world typically populates is a certificate of need. I think somewhere the regulatory authority needs to get into this kind of footprint, saying that for every 50 kilometer or 100 kilometer, you will have only one super specialty hospital. Unfortunately, what we end up doing is it gets into an abuse of resources. With every 25 kilometer, you have a multi-specialty hospital. So like the distance between Reliance and us will be barely 20 kilometers. And they're replicating exactly the same resources, what we have. So it is unfortunate, unless and until government is forthcoming in those kind of public-private partnerships or get into a meaningful use of the overall resources, I think it will keep some funds aside to invest in digital and other initiatives. Our roadmap in terms of digitalization is big time. And when we say digitalization, it is both ways. One is internally within the ecosystem of healthcare. There are multiple tools which we have enhanced, leveraged. Few of the examples which I can give is concepts like eICU, where we have a console managed by our intensivist, where we can take care of the ICU setups of the nursing homes in and around those areas. So those are the initiatives what we can get into. Another big time advantage what we see from adoptability of digitization is an element of standardization of quality of care. There are multiple tools which can act as a decision support system to my clinicians. That's a big plus. But unfortunately, my discussions with payers are always for discounts, what they want on tariff. They are not talking about outcome. They are not looking at my readmission rate. They are not looking at hospital-acquired infection. Unfortunately, that's the ground reality. So definitely there is no incentive from the payers, neither from the regulatory authorities, for us to go back and look at quality norms. But I think it boils down to the roadmap and the vision, what we have as an institute. But definitely I think digitization is here to stay in terms of multiple tools that the other members have talked about. Definitely it's a long-term approach that we need to look at in terms of from an overall patient care activity.
Sure. So we as a nation carry a huge burden of chronic disease as well. Some of these diseases have come to such large proportion that it's the size of the country. We see also products which are integrated today on the payer side coming on coverage of some of those chronic. Where do you see, from a payer perspective, do you see virtual health or digital health getting a push in the near future?
I think definitely there is a significant market size which is there for this kind of crying need. When we talk about aging population, obviously assisted living, which is a concept which is prevalent in Western countries, unfortunately is absent over here. And again, the agony and the apathy of our healthcare system is, I can get a shop license act and open up an hospital. Nobody questions me about the quality now. I can get into home care program without having the quality or the competencies to do a healthcare now from a home reach program. So those kind of standardization of quality needs to be driven first before we get into those kind of outreach element. When we talk about chronic diseases in particular, definitely there are multiple fantastic tools within the IT environment which we can leverage effectively. And the way healthcare is moving from an overall point of view, I think it's more of a inclusive care as we talk about, where it is a participative care from the patients themselves. Their families also need to be involved in the overall activities. Few of the tools as the team talked about is empowering the people by giving that tools and aids in their hands. Mobile can be a classic example where a lot of empowerment can be given to the thing as long as it is structured within the framework of quality norm. But definitely one of the classic example which I will give may not be relevant for chronic disease. Look at the element of the advantage of optimizing digitization. We have a concept which is known as corporate scorecard. So typically most of the hospitals get into a health check, which is one-on-one with individual people. So I give a health check report. At the end of the day, the employee goes out, the copy goes to the HR manager. We went a step forward now with the IT-enabled solution that we offer. I can give a corporate scorecard for the company. So this gives me the power based on the data that I'm capturing. Going back to the HR manager and telling him that 40% of your people are suffering from back pain. There are 30% of your people who are obese. Let me run a medical management program which will help you bring down the cost of care. Rather than somebody coming to my doorstep with a MI or a heart attack, this is a much better approach. But again, there needs to be an understanding from corporates also, individual payer groups also, in terms of going forward in that journey. But definitely sky is the limit in which technology can be used quite appropriately.
Sure, thank you. So I will arrange a question or two from the audience side for this panel to take. I'm sure healthcare, as I said, should not be left to the healthcare experts. That will be a disaster for a country. Before I go there, I have one last panelist who would answer the critical question about what is the ROI equation that when we talk about adoption of digital technology, is it just financial? When we move healthcare and not just the rupees, but the data, and we see efficiency in the clinical process, Dr. Shenoy, this is for you. If you can set your perspective, what is the ROI?
Interesting question. So, the question about ROI is irrespective of the nature of the hospital, whether it's a not-for-profit or profit, ROI is critical. And when we look at ROI, we are not looking at just the amount of money that you're putting into a system or the investment that you're making and getting money back. There are other things that could also go into the ROI, which could, for example, be patient satisfaction. So if you are looking at hospitals today, although a lot of people in the general public, the perception is that hospitals are making a lot of money, doctors are making a lot of money, and they are fleecing the public. If you look internally into the hospital's financials, most of them are in trouble. And they are looking for two things. One, how to improve their patient base, how to get more patients. And number two, how to improve patient satisfaction. I'm not getting into cost because a lot of work has been done by various companies on how to reduce costs in hospitals. I think we are now come to the absolute bottom. I don't think we can reduce cost further. The issue now is I have two CEOs and owners of hospitals here. Long time ago, I was also handling hospitals, stopped that. So the issue is how do I grow my business? And how do I satisfy my patient? Actually, they are not, they're linked. So we did a survey and we said that we realized that 70% of patients coming to a hospital or to a doctor, new patients, come by word of mouth referrals. 70% of new patients come to a doctor or a hospital by word of mouth referrals from satisfied patients. This is the key for growing your business. How do I satisfy my patient will actually ensure that I get my top lines going well. So, sir, your question about ROI is basically about patient satisfaction. And when I talk about patient satisfaction, we are talking in terms of two broad areas. One is clinical and the other is non-clinical. So innovations have to happen in both. So when we look at non-clinical, we are talking about patient experience. So we're talking about the ease of appointment, waiting times in the OPDs or with the doctor, etc., etc. There has been enough, there are at least 1,000 such startups. Out of those 1,000, probably 70% are focused on this. Electronic health record, appointment management, your website, web page, or some kind of feedback system. That's where most of the focus is. That gives you incremental value. What gives value to the patient is the clinical outcome. Am I better? Did I get healed properly? So I had surgery done. Did I get the effect that I was supposed to get? Globally, it is known that there is only 50% compliance to doctors' instructions. I'll repeat that. There is only 50% compliance to doctors' instructions. People don't comply. They don't comply to medications. They don't comply to dosages. They don't comply to timings. They don't comply on food. They don't comply on activity. There are a number of things. And technology is one area that can help patients to move into this area. That's what I think. And that can have a dramatic effect on the patient outcomes. We are dealing with an epidemic of chronic diseases, lifestyle-related diseases. It's no longer an episodic response where you come to me, I give you a pill, you go back and you're fine. No, you'll stay connected with me throughout your life because there's no cure for diabetes. There's no cure for heart disease. There's no cure for heart failure, renal failure, all the chronic diseases. So, technology needs to build this deep connect between doctors and patients, one. Number two, it needs to improve the patient's compliance. Number three, it helps the patient to find out whether they're having complications, and in case they're having complications, to detect them early and to manage them early. All of this is going to improve that patient experience that we are talking about, and this cannot happen by the conventional way of dealing with medicine. We have to innovate. So the innovation is not in technology. The innovation is in the way we are delivering healthcare. As you said very rightly, it's the mindset. It starts from there. Technology is just a tool. You wrap services around technology, provide a technology-enabled service, and that will make the dramatic change in your patients, in the patient's outcomes, patient satisfaction, and that will change the marketing requirements of a hospital.
It's a good one.
We have done that many times. Today, the world is changing, and innovation is here. There is no choice. We will reach there. Kicking, screaming, we will take doctors along with us, but eventually we'll manage this.
Sure, thank you, sir. So on that note, just a line that happened in the US health system in the early 2001, which triggered the formation of the Institute of Health Technology. is a report from the civil society, the Institute of Medicine. So on that, I would want to dedicate this question for the audience. You should, because it's as much the proactive participation of citizens. Healthcare, again, I repeat, should not be donated to the professionals or doctors. There's as much a role that each citizen have to play to make this safe for ourselves in the first place and make it affordable, sustainable, equitable. So is there any question from the audience? One question we'll have. A mic there, please.
Hi, my name is Abhinav, and it was great listening to all of you. So we actually work in the AI space, and we've actually worked a bit with a few healthcare firms on the hospital side as well. And I think it's globally known by everyone that in the healthcare industry, innovation is definitely harder than any other industry. So if you take banking or you take auto, these guys innovate much faster than healthcare. And rightly so, because I think, innovation is about running fast and breaking things, but in healthcare, you can't afford to break things, right? People will lose their lives if you make a mistake. So do you guys think that, the speed at which healthcare is innovating right now is fit and it's correct? We're going in the right pace, you need to go slow and steady, you can't break things. Or do you think there's still enough room for healthcare to be faster in terms of innovation?
So let me respond to that. So I was talking to the CEO of ITC Health. They've just started getting into health. He made a very interesting statement. He said today, innovations in healthcare are not happening in hospitals. It's happening in technology. It's happening with devices. It's happening with pharma. It is not happening with hospitals. And that's why I think the issue is. The person who delivers, that's a doctor, the healthcare deliverer, is where the innovation has to take place. And there, it's an issue of attitude. As a practicing physician, as a doctor, I am trained not to take things for granted. Anything new that comes to me, I will take it with a lot of salt. I'm trained that way. It'll take me 10 years or 20 years to adapt to new things. When you bring a molecule into use, the amount of time it goes into research is unbelievable. I'll give you an example. Let us look at this in terms of just managing treatments. When I was a third-year medical student, treatment for peptic ulcer was a milk drip. You used to take a cold milk, put it into a Ryle's tube and give it into the patient's stomach. This was third year, when I was MBBS third year, way back in 1980. By the time I reached final year, everything had changed. Milk was an absolute no-no for peptic ulcer disease. It was meant to be it is supposed to stimulate acid production. So milk was supposed to be banned. So in 2 years, so if I came for medicine, for my final year exam, and somebody asked me what's the treatment for peptic ulcer, and I said milk drip, I would fail. Right, so when you talk about innovation, there is a lot of scope. Let us look at one area which you talked about, because you are in AI. So there is this whole community ECG program that has been run by 2 or 3 companies which are innovating, right? So you do ECGs, you digitize them, you bring them into a cloud-based storage, run an AI on it, remove all the normal ECGs, pick up the abnormal ones, ask a cardiologist, look at them, diagnose, and bring the patient back for treatment wherever they are. That's a model that is running in Gujarat. But is that enough? That's the question that we need to ask. We have serious amount of heart failure patients in this country which have an iceberg effect. People don't even know that they have heart failure. There is no treatment for heart failure today except heart transplant. So if you could run analytics on a population saying, can we detect number of heart failures? Now the only point of care test costs $600, run by Abbott. 600 is too much for screening, isn't it? So we have to look at it holistically, seeing, is it technology, is it a service wrapped around technology, and in the last, again, is it financially feasible?
Sure, thank you. So on that note, can we take, I think the time is already up, I would request you to take it offline. On that note, I think I would like to conclude this very interactive, interesting panel discussion with a message that with the adoption of digital tools and proactive interest from healthcare providers and technical innovators, I think healthcare in India could move closer to your care in a way that you would want to experience. Thank you, ladies and gentlemen. Thank you, sir. Thank you, panelists. I hope the interaction was useful, and over to you.
Thank you, Dr. N.K. May I request you to please present the token of appreciation to each of our panelists? Thank you to all the esteemed panelists. Thank you, Dr. N.K.